Hello everyone, my name is Dr. John Abebe, the Medical Director of the Abebe Fertility Center. We started this series some weeks ago. We've talked about the age factor as it affects quality of egg. We've talked about the sperm factor as it affects the quality of sperm, and both of these factors will definitely affect the quality of the embryo. And we've also looked at the uterus, the endometrium, and looked at factors that can affect endometrial receptivity, and then we also looked at the treatment options that the patient decides on, because different treatment options will confer different success rates. Today we want to look at some medical conditions that are associated with patients that can affect the outcome of an IVF program. Medical conditions like hypertension, chronic hypertension, diabetes, thyroid disease. These are all factors that can go a long way to affect the outcome of patients while going through a treatment program. And that is why for patients who would come in to undergo an IVF program, we want to be sure that although they are hypertensive, that they have achieved very good control, and also that the medications they are on is not embryotoxic. And for patients who are diabetic, that they have achieved a satisfactory level of blood sugar control, because all of these all have an impact on the outcome of an IVF process. And I did mention the thyroid disease. We also want to be sure that the patient does not have a thyroid disease, whether it's hypothyroidism or hyperthyroidism. These are all factors that can affect the outcome of an IVF program. And so once at the initial evaluation of the patient, once we identify that the patient is a known diabetic or a known hypertensive, or through a history and investigations, we're able to determine that the patient has a thyroid disease, we would manage those conditions along whilst the patient is being prepared to undergo an IVF program. And with good control of such medical conditions, patients have gone on to have very good outcomes from their IVF process. So I just wanted to mention that could also be a factor, because poorly controlled blood pressure will not only affect, which is a systemic disease, it will affect the organs, the uterus, the endometrial receptivity. It will also, the medications that you're taking can also be harmful. So we need to check medications that such patients are on and ensure that they have good control. It's also important to state that some of the hormonal medications that are being used also can increase the blood pressure. So we'll need to adjust the dose, and for some patients totally change the type of medications that they are using. Also for diabetes, also the hormonal medications that are used during an IVF treatment can sometimes increase the risk or make it difficult for you to achieve good control with what you were previously used to. So for such patients, we need to review their medications, increase the dose until we're able to achieve satisfactory control, and then before we start off the process. And once we're able to achieve good control and we start off the process, then we're sure that such patients would be able to achieve great outcomes. So thank you very much once again for listening in, and I hope to see you very soon with another exciting topic as we look at the issues of human reproduction. Have a great day. God bless you.